going to see the important vasculitis along with some features. So before we start, some questions. The first question is, in case the inflammatory cells are involved in the Takayasu arthritis, so what are the inflammatory cells? The second one is the vessels which are involved in the Churg-Strauss syndrome. Name them. So we'll find out these answers and learn in detail in this topic. So to start with, we are going to look at the temporal. We are going to first look at the temporal arthritis. So what is meant by this temporal arthritis? Temporal arthritis is nothing but large vessel. It is the large vessel vasculitis. So what is the predominant vessels involved? The vessels which are involved are nothing but there is temporal, there is vertebral, as well as there is ophthalmic. There is ophthalmic, arteries and the aorta. So what are the inflammatory cells? So when you look at inflammatory cells, it includes the lymphocytes. It includes the lymphocytes as well as the macrophages. So next, when you look at the other features, so other features it includes is greater than 40 years. It is greater than 40 years. There is presence of the polymyalgia, as well as there is presence of the rheumatica, the granulomas, and the giant cells, and the presence of giant cells. So let's recap. So we saw the temporal arthritis. It involves a large vessel vasculitis, and it is a large vessel vasculitis. It involves the temporal, vertebral, ophthalmic arteries as well as the aorta. Inflammatory cells involved are the lymphocytes and the macrophages. Other features it involves, it is greater than 40 years old. It is the polymyalgia, there is rheumatica, there is the granulomas as well as presence of the giant cells. Next, we will look at the Takayasu arthritis. So this Takayasu arthritis, it is the large vessel vasculitis. It is a large vessel vasculitis. And what is the predominant vessel involved? The predominant vessel involved, it includes, there is a medium size and large size arteries. There is medium and large size. There is medium and large size arteries. There is presence of the aortic arch. Next, there is also the great vessels. There is pulmonary artery. There is also the coronary and the renal arteries. Next, if we see the inflammatory cells, what are the inflammatory cells involved here? It involves the lymphocytes. There is the macrophages, the neutrophils, as well as the granulomas and the giant cells. So the other features is that it is a pulseless disease. So let's recap here. We saw the Takayasu arthritis. It is a large vessel vasculitis. It involves the medium and large size arteries. Then it also involves the aortic arch, the great vessels, the pulmonary artery, the coronary and the renal arteries. Next, when we look at the inflammatory cells, what does the inflammatory cells involve? It involves the lymphocytes, the macrophages, then also the neutrophils, granulomas, the giant cells as well as the pulseless disease. Next, moving on, we will look at the polyarthritis nodosa. So the polyarthritis nodosa. So under this polyarthritis nodosa, what are the vessels involved? It involves the small, as well as the medium. Small and the medium sized muscular arteries. So small, medium sized muscular arteries, and it typically involves the renal as well as the renal and visceral vessels. So what are the inflammatory cells? Inflammatory cells involved, it includes the neutrophils, the eosinophils, the mononuclear cells. Neutrophil, eosinophils and the mononuclear cells. So what are the other features? Other features is that it spares the pulmonary vessels. It spares the pulmonary vessels, and 30% of the patients with the chronic hepatitis B. Chronic hepatitis B. So let's just recap. So we dealt with the polyarthritis nodosa. It involves the small and medium sized muscular arteries. It involves the renal and the visceral vessels. And the inflammatory cells involved, it includes the neutrophils, eosinophils and the mononuclear cells. The others is that it spares the pulmonary vessel. There is 30% patients with the chronic hepatitis. Next, we are going to look at the microscopic. Next, we will look at the microscopic polyangiitis. Microscopic polyangiitis. So microscopic polyangiitis, as the name suggests, it involves the small capillaries and the small arterioles as well as the venules. Next, what are the inflammatory cells involved here? So inflammatory cells which are involved here, it includes the neutrophils, eosinophils and the mononuclear cells. So what are the other features? The other features involved, it includes the necrotizing It involves the necrotizing glomerulonephritism. So this is about 90% of the patients, and it also involves the pulmonary capillaries. The pulmonary capillarities as well as the leukocytoclastic vasculitis. So to recap, we saw the microscopic polyangiitis. So here it involves the capillaries and the small arterioles and the venules. It involves the neutrophils, eosinophils and the mononuclear cells. And the other features is that it involves the necrotizing glomerulonephritism and the pulmonary capillaritis and the leukocytoclastic vasculitis. Lastly, we are going to look at the Churg-Strauss syndrome. So what is meant by the Churg-Strauss syndrome? Churg-Strauss syndrome. So this Churg-Strauss syndrome, the vessels, if you see what is involved, it involves the medium and the small arteries. It involves the medium and also the small arteries. And what about the inflammatory cells? The inflammatory cells it involves are the eosinophils. There's eosinophils. So eosinophil is required. And then there is also lymphocytes, the macrophages and the neutrophils. So what are the other features of this? The other features it involves, it is associated with the asthma. So it's associated with the asthma. There is the allergic rhinitis and there is a lung infiltrate. There's lung infiltrates. There is the peripheral. There is peripheral hypereosinophilia as well as the extravascular necrotizing granuloma. So to repeat, we saw the Churg-Strauss syndrome. So it involves the medium and small size arteries. The inflammation, it involves the eosinophils that is required, and then the lymphocytes, macrophages, and the neutrophils. Then the other, this is macrophages for M. Then the other is associated with the asthma, the allergic rhinitis, and the lung infiltrates and the peripheral hypereosinophilia, as well as a extravascular necrotizing granulomata. Now we'll go on to answering our question. So in the earlier start of the video, we asked 2 questions. Now let's look at the answer. So the questions were, the first question we asked about, what are the cells involved in case of the inflammatory cells in case of the Takayasu arthritis? So what are the cells involved? The cells involved, it includes the lymphocytes, the macrophages, as well as the neutrophils, the granulomas, and the giant cells. The second question we asked was, in case of the Churg-Strauss syndrome, what are the vessels involved? So the vessels involved here are nothing but, it involves the medium and the small arteries. So let's recap. So question 1, we dealt with, we asked the inflammatory cells in Takayasu arthritis. It is the lymphocytes, macrophages, neutrophils, and the granulomas and the giant cells. So these are involved. And in case of Churg-Strauss syndrome, what is the vessel which is involved? The vessel involved is nothing but the medium and the small sized arteries. So this was about the important vasculitis and their features. To learn and grow daily, please do subscribe.